discharged from a medical practice or told that they would no longer see you as a patient anymore?
All right, so this is a really nuanced but important topic, and that's the idea that should a pediatrician be allowed to discharge a patient when their parents do not want to vaccinate? And as a pediatrician, I have a lot of mixed feelings about this and thoughts because, on one side of it, there's a lot of parents who maybe don't want to vaccinate at first, but if you talk to them, you spend enough time with them, you get to see them over a few visits, you can actually convince them to vaccinate their child. And that's great. That's like the best possible scenario. The other possibility, or the other thing to consider here, is that even if they don't vaccinate, the child has other health conditions, and by turning them away, you're ignoring the child's other health issues. You're leaving them without a doctor. So there's a lot of reasons you want to continue seeing a patient even if the parents are hesitant to vaccinate their child, because you can still help the child and you can still work with the parents and maybe convince them to get some vaccines or all of them over time. So ultimately that is what's best for the child. However, there is one issue here, and something that's been very jarring for me as a pediatrician over the last few months with measles coming back. I've had parents in one room tell me, we do not want the measles vaccine, we don't want any of it, do not give that to our child. And then a few hours later, I'll be seeing another patient, maybe a child of a small baby or someone who's immune compromised, saying, I can't get my child the measles vaccine just yet. I know they're not old enough to get the shots, but I'm so worried they're going to catch measles and I don't know what to do. And then you're in such a conflicting place as a doctor, because that patient, the mom with the small baby or the immune compromised child, doesn't have the choice. Maybe they can't get the vaccine to their child yet. And by allowing other children at the practice who are not vaccinating, who might get measles and other diseases, you might be exposing and harming your other patients who don't have the choice or ability to vaccinate just yet. And so you have to wonder, am I harming my other patients and by exposing them to things and risking them to things by seeing a child who's not vaccinated? But at the same time, I'm harming the child who's not vaccinated by refusing to see them. And it's a very emotionally stressful thing, to be honest, as a doctor, and one thing that's really made this whole anti-vaccination thing very stressful on us pediatricians, because we're in a real moral dilemma and you don't want to feel like you're prioritizing one patient over the other, but that's how it feels some days, and it's very hard to deal with that. So I totally understand the doctors that continue to see their patients even if they don't vaccinate, but I also really respect and understand the doctors that turn anti-vaccination parents and patients away and discharge them, because really there's benefits and downsides to both.